Question number 8. Patella has a natural tendency to get dislocated in which direction? Superiorly, inferiorly, medially, or laterally? Now look here carefully. What I'm drawing is femur on the right side, the anterior view. This is resting on tibia like this, and that's fibula. It's here where this triangular sesamoid bone, the largest sesamoid bone, the patella, is located. Now if you remember the attachments on patella, on its base, there's this big muscle coming from the front of shaft of femur that's called vastus intermedius. This muscle gets attached here. There's another muscle which is attached on the lateral border of the patella in upper 1/3 or upper 2/3. This muscle is arising from the lateral lip of the linea aspera and is attached to patella on the lateral border like this, only in the upper 1/3 or a little more, you can say, but not to the entire lateral border. So this muscle is vastus lateralis. This is vastus intermedius. Onto the medial border, the upper 3/4 of the medial border, or even the entire length of the medial border of the patella, there's a muscle attached which takes origin from the medial lip of the linea aspera, and this muscle is vastus medialis. So you've seen that the vastus medialis has a wider attachment compared to the vastus lateralis. This has a significance. You should start guessing the answer. There's a muscle that covers vastus intermedius from above superficially. This muscle comes from the hip bone, from the anterior inferior iliac spine, as well as from a reflected head that comes from above the acetabulum. This muscle is bipinnate. Especially the superficial fibers of this muscle are bipinnate, and this muscle is rectus femoris. Now on to the posterior surface of the apex of patella. Remember, it is arising from the posterior surface of the apex of patella. There is this broad, thick tendon which inserts or gets attached to the upper half of the tibial tuberosity. Remember, not on the lower portion, but on the upper portion. If it gets inserted in the lower portion, there will be hyperextension at the knee. And this is ligamentum patelli. Remember, it's a tendon. It's a misnomer actually. Ligamentum patelli is actually a tendon of quadriceps femoris. The four muscles mentioned above together form a composite muscle, and that is called quadriceps femoris. This one, vastus intermedius, vastus lateralis, vastus medialis, rectus femoris, together form a muscle called quadriceps femoris, and the nerve supplies by femoral nerve. Now think about what will happen if all these four muscles, they're going to contract. When they'll contract, they will obviously pull this bone patella in this direction. Why not vertically? The main reason is that femur is not vertically aligned over the tibia. It is having an inclined position. So remember, the direction of the shaft of femur is directed downward, backwards, and medially. So that's why the force upon patella from above will be directed upwards and laterally, while this ligamentum patelli will be pulling patella downwards. So thereby there will be a resultant vector created, and this resultant vector will be forcing patella to get deviated on the lateral side. So that's the natural tendency. In some people, you'll find that when they plan to sit down in a squatting position, their patella gets shifted laterally. It moves out of the intercondylar fossa of the femur and it's shifted laterally. So that's a natural tendency. But to prevent this natural tendency of patella being shifted laterally, there are two major factors. One, you should have guessed by now, and that is the reason I asked you to remember the asymmetrical insertion of vastus medialis. So this is one reason why vastus medialis has a wider insertion on the medial border compared to vastus lateralis, because this helps to maintain a force on the medial side of patella while you are planning to flex and sit down in a squatting position. So this muscle, vastus medialis, is also called as locking muscle. This muscle, vastus medialis, causes locking of the knee joint while you are in the last 15 to 30 degrees of extension. Now there's one more factor which prevents this lateral dislocation, is the bony fat. You know that patella, the anterior surface you've already seen, it's roughened, having fine streaks like this. You can easily identify the anterior surface of the patella because you know it's tendon, it's embedded within the tendon, and that has regular pattern of collagen fibers. So because of that, you find there's vertical streaks like lining on the front of patella. But the posterior surface, is smooth, the upper 3/4, because the lower portion, that's the posterior surface of apex, that provides attachment to the ligamentum patelli. So the upper 3/4 surface posteriorly is smooth and is covered by articular cartilage, that's hyaline cartilage, that participates in the patellofemoral joint. And the patellofemoral joint is what variety of joint? Yes, it is a saddle variety of synovial joint. So I'm drawing here is the posterior view of the right patella. So when you see the posterior view of the right patella, you'll find that it's wedged. Actually, patella is like this in the posterior view. So being wedged, the more of the surface, this 2/3 is lateral surface and 1/3 is the medial surface. It's easy to remember. L for lateral, L for larger surface. Remember this. And this lower surface, that's the posterior surface of the apex, it's here, which is not articular. This is non-articular surface of patella, which provides attachment to the ligamentum patelli. Now the upper 3/4 surface of the patella, which is an articular surface, is actually divided like this into three portions, except a medial edge of the bone, which I'll tell you. So this is how we divide. Actually, it's the portion of the articular surface which comes into contact with femur at different stages of flexion of the knee joint. Let's presume this one is the area number 1. This area number 1 comes in contact with femur while you are standing, that is in the full extension. But as you plan to sit down, this area number 2, including area number 1, that is area number 1 plus area number 2, that much of area comes in contact with femur. That's in position of slight flexion, maybe beyond 30 degrees, you'll find area number 1 and 2 will contact femur. Now when you reach a flexion of around 90 degrees or more, then this area number 3 will also be touching femur. Means area number 1, 2 and 3, all this area will be in contact with femur when you are flexing your knee beyond 90 degrees. But when you come in a full flexion of the knee joint, that is the stage of squatting position, when your back of leg touches the back of thigh, that's there, this medial edge of the patella, that is area number 4. So that's how in case of squatting position, all the areas 1, 2, 3, 4, they all will be touching femur. Means what? The patella actually gets buried in the intercondylar fossa. You can palpate and feel it on yourself. In a squatting position, you find that patella has actually disappeared. Now the reverse pattern will be followed while you stand up from the squatting position. Firstly, the medial edge of the bone will come out of the intercondylar fossa, then 3, then 2, then finally when you will stand back in erect posture, it will be only area number 1 that will be touching femur. Now why not take a transverse cut section of patella? This is how you'll find is the right patella. All the images I'm drawing is of right side. This one is the anterior view, this is the posterior view, and this one, now the last one I've drawn, is the transverse cut section. So obviously, as I told you, the larger area on the posterior surface, 2/3, will be the lateral surface, and the lesser area on the posterior surface will be the medial surface. So medially it is 1/3, laterally it is 2/3. L for lateral, L for larger. Remember this mnemonic: L for lateral, L for larger. And this will even help you, remember, in the side determination. Very oftenly it's asked in your Viva Voce exam to identify the side determination of patella. So you can very easily confirm the side determination of patella by holding the patella as if it is your patella in your hand, with the anterior surface placed, anterior articular surface placed posteriorly. The base of the patella should be above, the apex of patella should be below. And with this position, you place the patella on the table. The side to which patella falls will be the side to which patella belongs, right? So that is how you can confirm the side determination of patella. Side determination of patella, that also has been covered in this topic. Now imagine, like in a squatting position in full flexion, what happens is, this is how patella gets buried in the intercondylar fossa of the femur, right? So because of its wedged surface, the posterior surface being wedged, it prevents the lateral dislocation. So this is prevented. This one is lateral side, this is medial side. So this posterior surface being wedged actually prevents the natural tendency of patella being dislocated laterally. One is this bony factor, and the other is the locking mechanism because of asymmetrical wider attachment of vastus medialis on the medial border of patella. So I hope you got the answer to this question number 8, that patella has a natural tendency to get dislocated laterally.